In general, hospice is a model of care developed to provide comfort and support during the terminal phase of an illness. It is generally provided when folks have been given a prognosis of 6 months or less to live. And when someone moves into hospice, they stop curative treatments and they shift the paradigm into a lens of just comfort and support as they transition to death. In most cases, hospice requires insurance. It requires a home setting or a place in which a person can live to receive that care. It requires a primary caregiver. And so, even if we just start right there, folks experiencing homelessness, they do not have some of the foundations of how hospice care is delivered. So, um, because of that, there has been a development of many different social model hospice organizations and comfort care respite houses. So, the idea behind a social model hospice is that a place is bought, whether that's an old hotel or an old house. And within that house, a community can be serving as the people to keep that running. So, in the case of the In Between in Arizona, that's a beautiful example of a social model hospice. Folks with lived experience and past experience of homelessness, they serve as the direct care staff. They serve to caretake for the home and for the people living in it. And what this provides is one, beds for respite care, so that if someone who is living on the streets has to have surgery, is experiencing or living with serious illness, they need to heal. They need places to heal. And so this is like a temporary space for them to heal and get better from injury, illness, or surgery. Um, in these homes, we also have beds designated specifically for hospice care. And so it provides the home, the space for them to transition in. There is direct care provider staff. And then hospice agencies come in and provide the hospice care specifically. And so it's a beautiful way in which people experiencing homelessness can get some of that model of care. In terms of ANELDA, we work with all different kinds of hospice organizations. Some are the social model hospices, some are for profit, non for profit. And what we have worked with them to do is to oftentimes train their volunteer staff as end of life doulas so that the care they are providing is person centered. Their doulas are self aware of their own biases, preferences, and sort of moving that out so they can really support the autonomy of someone who is dying. Uh, and as we've worked with those hospices, their death doula staff really works with the people to deliver compassionate, equitable care at end of life, to really understand their preferences and desires, and then advocate for those wishes with the interdisciplinary team and the people who are working in that particular model. Sometimes in this world of end of life, we hear the terminology a good death. And from our perspective at ANELDA, we define that as whatever the person defines that as. I think back to just some of the key things that folks look for at end of life, right? Like a safe place to die, not so much pain, a support system around them, and just really folks who are listening to them and doing what they're asking. For us, that is the foundation of a good death and good outcome, is that when we have places for people to feel safe, they're comfortable, and they're being listened to, they're being heard. And if they can have their circle of care around them, we know that that is a positive impact, a good outcome at end of life.